Welcome to my channel. Before we start with the chapter 3 cultural considerations, I will add the PDF down below description. You can try it. It's from Google Drive, but it's a PDF, and we'll have the key term, the definition, and explain about it. And through the video, I will just say the key term, and then I will explain it. And the definition, you can just follow along through the screen. And I hope that will be very helpful for you to memorize and to understand why this chapter is important. They have few keywords that they're really important in medical and for nurses, and that's why this chapter they kind of teach in the beginning. Thank you. So now we start with chapter 3. We start with chapter 3, cultural consideration keywords. We have about 31 keywords to understand for this chapter. So number 1 is ageism, which means to avoid assuming an older patient cannot learn new skills. Use take back when explaining medication changes. Bias, very important. Be aware of personal preferences that may affect triage decisions. Conscious, explicit bias. Refusing to use patient's preferred interpreter because you believe English practice is good for them. Cultural awareness. Reflect on how your own holiday customs differ from a patient's when asked what support they need while hospitalized. Cultural competence. Use a certified interpreter and adapt dietary teaching to traditional foods. Cultural humility is like ask, what does good health look like to you before planning care? And let's move down. Oh, my mouse. Cultural humility. Again, ask what does good health look like to you before planning care. Then cultural sensitivity. Provide space, for example, a Muslim prayer times without interruption. Culture. Understanding that silence after bad news might be a sign of respect in some cultures. Discrimination. Scheduling fewer therapy sessions for non-English speakers is discriminatory and impacts recovery. Disparity. Higher material mobility in Black women versus white women indicates a health disparity. Diversity. Creating unit posters in multiple languages reflects workforce and patient diversity. Ethnicity. For example, Latinx patients may prefer family-centered decision-making, reflecting ethic values. And ethnocentrism. assuming Western punctuality norms apply to all appointments demonstrates ethnocentrism. Now go to gender. Document chosen pronouns to guide respectful communication. Gender identity. A patient assumed male at birth may identify as female, use she, her pronouns. Health disparity. Limited dialysis sites in rural areas contribute to renal disease disparity. Yes. Health literacy. Use pictograms for low literacy patients when teaching wound care. Identity. Asking, what name do you prefer we use? Affirms patient identity. Inclusion. Displaying price symbols signals inclusive care for LGBTQIA patients. Now we have LGBTQIA. It's to understand unique health screens. For example, a prostate exam for transgender women on estrogen. Implicit bias is using standardized pain scale reduce implicit bias in analgesic dosing. Literacy. Confirm patient can read description labels, offer large print if needed. Person-centered care, an approach that respects and responds to individual patient preferences, needs, and value, which means involve family in care planning when cultural appropriate to a patient. Misgendering is referring to someone using a word pronoun form to address that does not align with their affirmed gender, meaning calling a transgender man ma'am can erode trust. Use correct honorifics. Race, a socially constructed category used to group humans based on physical traits like skin color. Recognize that race is not biologic predictor but can be signal social determinants. Racism is a system of structuring opportunity and assigning value based on race that unfairly disadvantage some and advantages others, meaning calling security more quickly on patients of color reflects institutional racism. Social determinants of health is conditions in people are born, grown, live, work, and age that affect health outcomes, meaning assess food insecurity during discharge planning. Stereotype is oversimplified generalization about the group without regard for individual differences, meaning assuming all, for instance, Asian patients prefer herbal remedies in a stereotype. Next, stigmatizing is labeling or treating someone as socially unacceptable because of a trait or condition, meaning disclosing a patient's HIV status loudly in the hallway, that is stigmatizing. A little bit lower. And transcultural nursing is comparative study of culture to understand similarities and differences in patient care. Meaning the sunrise model, very important, by Leninger's guide on transcultural assessment. The last one is xenophobia. It's fear or hatred of strangers or foreigners, meaning a patient refuses care from an immigrant nurse, requires de-escalation and education. So this is all about all the keywords of chapter 3, and they are very important to remember when you do a quiz and study for the outline and the whole chapter. But usually the most important in the quizzes, they are about bias. How many types of bias, a little bit of racism, can be also a little bit about LGBTQIA. Also it's very important when they ask about health literacy during the discharge or coming in, because you used to use the pictograms for low literacy patient when teaching, for instance, a wound care. And you kind of know to make sure the patient can read prescription label, and you need to offer a large print if needed. That is the literacy. Very important, the bias, stereotypes, stigmatizing. It's a lot of xenophobia from patients towards the nurses, but we have somehow to teach them. What else is important about cultural? Because some people, they have their own way to do their routine, like prayers, or they want some traditional foods versus, so that it's cultural competence. Another one, it's very important about the gender identity. It's a lot everywhere. It's she, her pronouns, or he, him. And ethnicity, like when a social group that share common and destructive culture, religion, language, or national origin. Like for instance, the Latins patient may prefer family-centered decision making, reflecting on, like I said, ethnic values. Yeah, that's it. Just be aware of biases, bias, a lot of bias.